Hi, I'm Charmaine. I'm from Nasotech and I'm here today to talk about our new product, Diclonase. So in Australia, Voltaren is one of many anti-inflammatory drugs on the market, commonly taken for pain associated with inflammatory diseases or injuries involving muscles or joints. It is available in many dosage forms and strengths, including enteric-coated oral tablets, oral capsules, oral liquids, powders, suppositories, and topical gels. So when prescribing or dispensing diclofenac, it is common practice to importantly inform patients that the tablets must be taken with food. This is to prevent gastrointestinal side effects, such as the onset of progression of gastric ulceration. This is a source of inconvenience and thus becomes a problem for many reasons, affecting patients' likelihood of taking diclofenac. Other reasons may include religion, such as fasting, and inability to swallow the enteric-coated tablets. For these reasons, our team at Nasotech Pharmaceuticals have looked at the feasibility of an alternative dosage form for systemic absorption and have developed Diclonase, a diclofenac nasal spray. So now we have Angie from Nasotech here to talk to us about the new product, Diclonase.
So diclofenac is an acetic acid. It's a poorly water-soluble compound, therefore it's normally formulated as a salt. Usually sodium salts, however you can have potassium salts, pyrrolidine salts, or diethylamine salts. Formulation as salts enhances solubility and the dissolution rate. This is really important because it's only the molecularly dispersed form of the drug at the absorption site may cross the nasal epithelium for absorption. So drugs that normally qualify for optimal nasal absorption follows the Lipinski's rule of 5. It's normally for oral absorption but also applies for nasal absorption. Diclofenac is one of these drugs that goes well with Lipinski's rule of 5 because it's a lipophilic organic acid which allows it to be easily absorbed across membranes. It's also, the salt formulation is hydrophilic, which further enhances water solubility and dissolution. Another intrinsic feature of diclofenac, which complies with the Lipinski's rule of 5, is that it's a really small molecule as well, which is good. Diclofenac is a weakly acidic drug, therefore it's unionized in acidic conditions, which gives it good absorption through the mucosa. As well as good absorption, the weakly acidic properties of diclofenac don't inactivate the lysozymes in the nasal mucosa, which actually protects the nasal mucosa, so that's a good thing as well. We also know that diclofenac is a short-acting NSAID with a half-life under 6 hours, so it has a fast elimination rate. This means for it to reach maximum concentration, the systemic circulation is quick and it can be cleared quickly, so you can use it a couple of times in a day, which is really good.
That sounds amazing.
Awesome, thanks for having me.
Thank you, Angie. Now we have Lillian here to talk to us about the formulation of Diclonase. So why a nasal spray?
So one of the main reasons why we developed the nasal spray is because the oral tablet formulation undergoes the first pass effect following oral administration. So it only leaves the diclofenac drug about 50 to 60% metabolized. Furthermore, long-term use of NSAIDs have also been known to be associated with gastric erosion and irritation, predisposing many long-term users to dyspeptic symptoms and gastrointestinal ulcers. So because of those reasons, we formulated a nasal spray. And why the nasal route was so charming to us, it's because the nasal route has a rich vascular supply, so that gets more of the drug inside the system. The nasal mucosa has a high permutation for drugs, bypassing the first pass metabolism, which is the problem with the tablets in the first place, allowing the nasal administration route to achieve faster and higher drug absorption. As Angie explained, the salt, it has to be in salt form before it's in solution to make it absorb a bit quicker. And we found out that the diclofenac potassium salt is much better than the diclofenac sodium salt. Furthermore, diclofenac also has a short biological half-life, about 1 to 2 hours, and a fast elimination rate of about 1.2 to 1.8 hours, which means that frequent administration of the drug is needed. So that means that frequent administration of the drug is needed to maintain a therapeutic concentration. Again, this could contribute to the patient's prolonged use of the NSAIDs. That creates the problem. So for that reason, that's why we also made a nasal formulation. However, oral bioavailability is still a problem, as diclofenac is lipophilic. Once in solution, it's rapidly absorbed in the nasal cavity via the transcellular route of administration, and it demonstrates a nasal bioavailability similar to that of intravenous administration, which is almost 100%. So that's why it's so appealing to us.
That sounds amazing. Thank you, Lillian.
Thanks, Charmaine.
So now we have Shakara straight out of the lab of Nasotech, and she's here to talk to us about what is the ingredients included in Diclonase.
Hi, Charmaine. Yes, so there are a few excipients added to Diclonase. First of all, we've added a co-solvent glycerol to increase the solubility of diclofenac. We've also added a preservative, potassium sorbate, and an antioxidant, EDTA, to increase the shelf life for our customers. We have added a buffer as well to reduce any irritation and make it pH compatible with the nasal mucosa. So that was sodium hydroxide that we added there. And we've also added a gelling agent, methyl cellulose, to increase the residence time of Diclonase in the nasal cavity. Lastly, for our customers, we've added a pleasant smelling flavouring agent, menthol, to increase patient compliance.
Beautiful. So what's included in the whole manufacturing process of the nasal spray?
So basically, it's all it's all done in the lab under sterile and aseptic processing. So you add the diclofenac salt and excipients to water for injection, and it is then sealed into a glass vial, and all our products are tested for reproducibility and robustness so that we are producing the highest quality product on the market.
That sounds amazing. Thank you, Shakara, for your time.
Diclofenac exerts its analgesic and antipyretic effects by competing with arachidonic acid in binding to cyclooxygenase enzymes, predominantly COX-2. So binding to the COX-2 enzyme results in a decreased formation of prostaglandins, the main catalyst you'll find in inflammation and pain.
So what about the dosage forms that are available?
Yes, as my fellow colleagues discussed, oral diclofenac has an oral bioavailability of 50 to 60%. So with our proposed formulation, the nasal mucosa has a bioavailability of about 100%. So theoretically, we can reduce the nasal dose concentration to that of half of oral diclofenac. So we proposed a dose formulation of about 12.5 milligrams per nasal actuation. So therefore, you would theoretically have a loading dose of about 25 milligrams, so which would be 2 actuations. Subsequent dosing would be 1 nasal actuation, and the max dose you would see in a day would be 16 nasal actuations.
So what made you choose the nasal mucosa as a candidate for this formulation?
Yeah, so the nasal mucosa is an ideal candidate for administration due to its large surface area, porous endothelial membrane, high blood flow, avoidance of first-pass metabolism, and avoidance of the GI tract, high accessibility, and rapid systemic absorption. So the main site of systemic absorption is by the nasal cavity, is within the turbinates. Additionally, some drug will be deposited in the respiratory region and can also gain access to the systemic circulation. So drugs delivered by the nasal mucosa can cross the nasal epithelium membrane using 2 different pathways. As diclofenac, as Angie said, is a relatively small uncharged particle, so therefore it will cross the nasal mucosa paracellularly. You'll be able to see with our literature review online some of the barriers we face. So we have physiological barriers, so we have that of the nasal mucosa, the nasal epithelium barrier, you have mucociliary clearance, nasal metabolism, and efflux transport systems. Some of the physiochemical barriers that we have faced developing our nasally delivered diclofenac has been drug solubility and dissolution, molecular weight and size, compound lipophilicity, pH and pKa, And lastly, some of the formulation barriers we've faced have been drug concentration, dose and volume, the osmolarity, and also the site of deposition.